Our next speaker, Dr. Geeta Patki. She is MD in Stri Vandhyatva from Jamnagar. She is Ayurvedic Gynecologist and Ph.D. scholar at Maharashtra Vidyapith. She is HOD and Professor in the Stri Vandhyatva at Gomantak Ayurvedic Mahavidyalay Research Center, Shiroda, and has been working since past 24 years. She is the recipient of the Dhanvantari Award 2017 and has been awarded for best papers. She has also been felicitated by Dhanvantari Award by Government of Goa on Dhanvantari Jayanti on Ayurveda Day 2022. She is the initiator of Suvarna Prashan and has redefined Suvarna Prashan at Gomantak Ayurveda College, Goa. I request Hemlata Gogate to felicitate Dr. Geeta Patki, Madam. Yeah, madam.
Yes. Pointer yes. Good noon to all. First, I bow my namaskar Sriyut Vaidya Gogate sir, all family members of Gogate Pratishthan, renowned Vaidya, and my dear friends. I understand it is too much late, but still bear me, because so many interesting talks are going on. And I thanks to Dikshit sir and madam and previous speaker who has highlighted my few points and helped me a lot. First of all, excuse me, I am clinician, I am physician, I am practicing gynecologist. Okay, that's why, so we are quite aware, we are referring our text. But the scenario when patient comes to you, and especially Ayurvedic gynecologist in a corner of Goa, where first of all, it took some days or months to settle and tell, yes, there is a Stri Prasuti Tantra in Ayurveda. That is the first step we understood, because I studied in Mumbai University, then Gujarat, and somewhere and now in Goa. And that's why it is a learning process for me also. And see, as the same question, same problem for us. Patient used to come to test you. Patient comes to test my science too. Patient comes to you with only the opinion, this is my gynec, huh? And he told, yes, and now it is add up, because see, 24 years I am learning only. Maybe from different styles, even from the students too. And now Googling and WhatsApp, new straya, new. That's why I wrote one word, is a new challenges too. With this brief introduction, I am assigned here for the Hetu of the Stri Vandhyatva. You are well learned audience. अरे ये तो हमको मालूम है. Still, you understand this is a compilation too. Yes, this is a shlok from the Jati Sutri Adhyay Charaka Sharisthani 8. The couple who is willing to have a Shreyasi Praja. I want Vivekananda, I want Sachin Tendulkar, I want Lata Mangeshkar in my house. Then it is a good indicative for that. Arey Baba, you should have upper line. Stri, Purusha, Avyapanna, Shukra, Shonit, Garbhasha, etc., etc. And now you follow what is told in classic. That's the meaning of it. I am quite aware. I am going to talk on Vandhyatva. The clear meaning of it, the lady or the couple is a childless. Nothing new in that. Maybe due to so many reasons. हमारे पास कुएं में गिर के ही आते हैं, अभी बचाओ. I had मिथ्या आहार, I had मिथ्या विहार. Doctor, you are telling 100% right, but still I had hormones because now Ganesh Chaturthi is there. Adjustment, Ganesh Chaturthi, my season start. Date adjustment. Is there? Is the practical? That's why I'm thinking. So many things are not written in books. Still we are facing and cross. Still we are coming as an Ayurvedic gynecologist. So, the Vandhyatva is a childless couple. So far, by definition, this is a medical condition. This is a medical condition. So many factors are working on that. Maybe aharatmak, viharatmak, vyadhijanya, manasik, so many things. Fantasies and fallacy, and new question is there, new addition is there, assigned. My promotion is due in 2024. That's why in October to December I should conceive. And so that, like that Bhannat type of patients are coming to us. Reality. Arey Baba, you don't have pregnancy, you have so much big file. And still I am supposed to do the miracle. Majen mi sangte maja photo neun lav. So really is reality for us, for me also. So this is the Vandhyatva. The infertility, by technical language, is a couple is not using any contraceptive. They have regular coitus. The considering, if the lady is not able to conceive, then conventionally we are referring this as the infertile, stamp them, and you start digging like the investigation and the treatment. With the so many factors, still we are able to prove the promising results. Promising results. I know the so many people are practicing for the infertility and their own cages, at their own level base, they are getting the success results. Still, there are wide range of the challenges. Wide range of the challenges. Recurrent pregnancy loss, APLA syndromes, IUDs, and now it is addition to that, post-COVID effect. In a first wave, after the first wave of the COVID, all Ayurvedic gynec or all gynec were getting the problem or the menstrual problems. Heavy bleeding or clotted bleeding, leading to unexplained abortions, unexplained IUDs. So the meaning, we have the own investigative areas, then the Gogate. Still, we are reaching till the challenge of IVF failures. We are getting 9 times IVF failure, 120 times IUI, so many different variety of the patients we are getting, and now you do your duty. Like that they are coming. Still they will cross me. So this is a wide area, wide umbrella, but still consistently we are thinking and working, we are getting the good results. That is the saying of the first slide. Yes, these are just, I feel I will go fast. These are the prevalence. So many surveys, so many records. Still, it is a worldwide problem. The couples are infertile. Even all the factors may be normal or abnormal. So the prevalence is so high. See, I have tried to show in piecemeal also. Ayurveda treat the female body as a one machine, one part, and modern science, they are telling cervical factor, vaginal factor, correct that factor, still they are not able to conceive. So this is the prevalence rate. Different surveys have done. This is a fertility rate or infertility rate is increasing, decreasing with the Gogates. Say for example, the latest one NFHS survey, the urban area they found, or even the high socio-economical groups, maybe due to stress, strain, so many things, the infertility is so high and total fertility rate is reducing. That is a big question. I want to highlight total fertility rate, that is in a one life or one lady, in whole reproductive life, the chances of conception. If I am telling the total fertility rate is 1.7, that means in her life, she can conceive, she can give birth to the one live baby and one abortion. Or one lady, she may have the total fertility rate 3 and exactly ulta, second one will be 0. Okay, that is a fertility rate. Now it is decreasing and okay, that's why we are here. That is thing. It is a decreasing. So many questions are there. I am not making you afraid, considering this is our opportunity. Yes. Then new researches. The previously years before, thinking from the patients or the social or the medical sense, अरे कुछ भी खाओ ऐसा कुछ नहीं. Now they turn to the dietitian. So Ayurveda strongly believe there is a effect of ahar. Madam have described in detail. We also follow that. We also motivating to the patients. Yes, it is a clear-cut mention. Chances of the malnutrition, or they use the term fertility diet. The diet affecting to the fertility. Directly reflecting definitely to the fertility. And it is proved if the lady is having fertility diet, 66% reduction into the infertility. Just I compiled and put in front of you. See it is a ready recognizer for you. It's a what a keys or thinking points I am giving to you, and it is a compilation for you. Yes. See where we are and where we are going. This is the total fertility rate. Increasing, decreasing with the parallel to the growth rate. This is a major issue. Fertility, everything you have. I am giving the one example to the student. Books are there, teachers are there, college is there. If your mindset is not there, who is going to do? That's why everything, so far, so factor. That's why the concept of the unexplained infertility. That means 100% there is a reason. We are not able to prove it in the terms of the unit. Yeah, I have stress, I have chinta. How many units I will explain? It is there, everyone is accepting. Patient is accepting, doctor is accepting. Like that, where you can't prove it or you can't explain it in the terms of the unit, it comes into the groups of the unexplained. And friends, it is going to 25%. It's a major issue, major question for the gynecologist. That's why IVFs are failed. Just imagine 9 times IVF cycles, 100 times IUI. One patient came to me and she told, Madam, after my marriage, I went to 120 times IUI, means every month, literally. Madam, I don't want child, please stop my treatment. That's why I heard word. Now, मला आत्ता सध्या काही नको. Madam, please admit me. Otherwise, if you are giving oral medicines, then again that cycle start. Day 4th medicine has to start, then ovulation study, then again she get the period, then literally what dispute in families or so many things. That's why, see, the infertility or vandhyatva or childlessness, it now become is a social disease too. It affect the lady physically, physiologically, psychologically. So many marriages are breaks due to these issues also, and it is applicable to all social strata, not only the lower strata. High socio-economical or good family background, highly so-called educated. So the meaning itself is a major issue, major condition, and covering all corners of the world. This is a classical review. Where exactly infertility? We know that Yoni Vyapat, we know that Artava Dosh, we know that effect of the Ahar and Vihar. These are the some references I have compiled and corrected. The meaning itself, core meaning itself, like Rakta Pradar, Hetu, Samprapti, Chikitsa, type, Bhed, it is not given. But yes, all classics have highlighted this the condition. All classics have mentioned, or even Dr. Dikshit told, from Vedas also, the condition were prevalent. That's why it is given in books. See, we teach in classes complications. When I was student, that time I was thinking, doctor made, that's why it is complication. But the real meaning of it, the complications are present. That's why even given in the books. So the meaning itself, see, like for example, in Sushrut, Vandhya Yoni is given. The Vandhya who will label? Who got a Nashtartha. That means the previously it was present and now reproductive age due to some or another reason. There is a Artava Nash, and that's why she become Vandhya. Not applicable after the 50, 16. Till date in India no one comes. No, 60 and I stop my menses. So the meaning itself, Sushrut had given the word Vandhya Yoni or injury. Viddhatva to the Artava Strotas along with the Maithuna Satva and all. Vandhyatva will be there. Charak, he used the Sapraja Vandhyatva. Directly. Charak, in books it is given Sapraja and Apraja. Sapraja Vandhyatva has given, and a good causative factor list is given. In Yoni Vyapat, he highlighted Asruja Yoni and Labde Garbhe Api Asruja. There is Rakta Pitta Kare Narya. The Hetu are given, Rakta Dushti, Pitta Dushti, Ardhava Dushti. Due to that, Ati Rajastrav is there. That's why label that condition is Asruja. And definitely if the lady have conceived inside, it is going to take your child. And this is the Apraja. Tikakar cleared. No, it is Avandhya. See, it is Avandhya. That means she had a child, and due to some another reason, now she is not conceiving. She is not totally Vandhya. She is Avandhya, and if you are relieving or if you are removing those factors, she may conceive. Even Vandhya is also enlisted in Sahaja Vyadhi, especially Viruddhahara seven by the parents. Then Kashyap have given Jataharani. It is one example I put, Pushpagni Jataharani. Then in 80 Rog of the Nanatmaj Vyadhi of the Vata. Then Vyanjana Dosh are given. Later on it will come. Okay, this type of the Yoni is there. Uchipta Yoni is there. Then there may be the Vandhyatva. Again he has highlighted the complication of the lady is not suitable for the Panchakarma, and you are giving the Tikshna Vaman or Virechan. There may be the Bijopaghat and Pushpaghat like that. See, up to Bela also, he has highlighted almost all Hetu, the core meaning of it, all classic notes, the Vandhyatva in detail. Yes, what Ayurveda say? You and me, while studying Ritukshetra, Ambu, Bijanam, component, essential factors, spare parts, like that, yes, we are grossly, superficially, while treating or categorizing, these are the major component, and all factors work in hand. It is not like that. It work hand in hand. That's why spare parts. Without steering, we can't tell this is a car. Without wheels, all factors are equally important, like Charak has also told. Shadbhava are there. So the meaning, all appendages work hand in hand. Essential consideration. See what I mean to say. Hetu of the Stri Vandhyatva are so many, and I am supposed to compile or explain in short span. So while reading I understood, see there are two categories, or what I am labeling preconceptional and post-conceptional. Or Garbha Nirmiti is one part, Garbha Vapan is the second part. That's why some ladies are coming to you, they have the ability for the conception. They tell 5 times I abort, 6 times I abort, in a span of 4 years, in a span of 5 years, like that. Or up to conception, few weeks, pregnancy continued. And now new concept is there, blighted worm, chemical pregnancy. That means somewhere there is a Shukra Shonita Sayog and yes, Atma Pravesh, because our definition is not only the Shukra and Shonit. Atma Pravesh, some Atma, someone is going to come at your place, please welcome. Acceptance, hospitality or readiness, preparedness is required. Till time something was normal, and afterwards continuation of the pregnancy is a problem. They may lose, they may abort, they may demise, so many things, or they may complicate in some way. So, as though you know that the Garbhotpatti is a very complex but the physiological event. Like one of the respected speaker was telling previously, it was not there, silent, so many things are there. I accept in some limit for that. So many factors account, but it completes in two ways, two parts. So I tried to divide Garbha Nirmiti, fertilization, what easy word for understanding. Union of the Garbha or Shukra and Shonit at Kukshi. Okay, that means maybe Shukra is normal or Sthana is normal or other factors are normal. Second is a Garbha Vapan. And this is the term given in Charak itself, implantation. Where the place, where the room is not friendly. Where that Garbha Shaya is present, but that coming Garbha or coming Atma is not welcome in way it is supposed to be. The failure for that. So I tried to divide the preconceptional factors is a prerequisite essentially. I am supposed to come to Pune, I will get ticket, my bag or dressing, everything is a requirement. Then matter It's important. So I tried to divide. It's extrinsic because external. Patient comes to you. These are not in my hand. Already गिर गया है, हुआ है, disease है, treatment, अमुक तमुक, everything is there. My duty, try to correct that level based. Try to, because the one later on it will come, Prakriti. I know that Prakriti, I am not going to change. But with the ahar, with the vihar, with the medicine, with the counseling, I am trying to make it level based for my utility. For my utility. So these are the extrinsic factors, and later on the component factors essentially for the implantation, which is in patient's body, which is in my hand, that is intrinsic factors, what I mean to say. So, the female bears major part, Rutu, Kshetra, Ambu, and one part of the Bija also, 87.5. And that's why till date in India, the blaming for the female is still going. And the matter doesn't end here. Still she has to continue the pregnancy and childbirth. Why? Because, see, our definition of progeny, our definition of the Garbhotpatti, or our definition of the Vandhyatva, not ending only to have a urine pregnancy test positive, no. To have a live birth. That's why Harith have explained in detail. Harith is a person who have enormously given the wide range for the infertility causes. Understood Balyavastha is there, Garbhakosha Bhanga is there. I understood the meaning of it. Maturation of the system is not there. Or the Bhanga of the Strotas, or Bhanga, or any injury, or diseases of the Garbhashay, not able to continue the pregnancy. Understand in Garbhakosha Bhanga. Dhatukshay, he used the word Dhatukshay and down Balakshay. Ki like dhatu, related dhatu, rasa, rakta, which is going to help to produce the Garbhashaya or Garbhashayastartha. I am clear cut mentioning the terms because everyone know that Arthav having the so many meanings. Garbhashayastartha, Bijashayastartha or Sharirastartha, hormones, ovum and endometrium. Our now first few months of post-graduation went in that fighting only. Then we came to conclusion, array, chalo, endometrium is endometrium. Garbhashaya. Because that's why I cleared, I am clinician. So, the meaning itself, Dhatukshaya avastha is there. Then, Kakavandhya, Anapattatya, Garbhastravi and Mrutavatsa, which complete all bad obstetrical history. Core meaning of it, according to our science, it is Vandhyatva is not only limited to the non-achievement of the pregnancy. No, only pregnancy positive. No, it is achievement till live birth. That's why rest of the condition, maybe death during delivery, intrauterine death, perinatal death, abortions, it comes under the Vandhyatva. I hope this is my basic theme of the presentation. Yes, just have a look. Nothing new in that. Artha Strotas, Garbhashaya place in Shroni, which is the sthana of the Mula sthana of the Vata. The understanding from my side, the very small Mausaja avaya, where the Ushna Artha is produced, takes active participation in Garbhakrut, continue the pregnancy, expelled out, take the active participation in Garbhajanma or the Prasav, which is totally covered with all the Kundalika or all Vatasthana. Anteriorly Mutrashaya, posteriorly Malashaya is there, and wherever the space is there, it is covered with the Vata. That's why India surrounded by the XYZ countries, not telling. Ushna Artavasthan, which is Mrudu, where a little bit Strikara Bhava it is given. See, Mardavata is there, Kleda Bhuishtata is Kleda in the terms of the wetness or the rasiya. Always it is expected, female must have, or reproductive lady must have the rasa bhuishtata in normal cage, not rasa vruddhi and all. Wetness is there, softness is there, nibidata is there, ghanata is there, and top of that mardavata is there, is a speciality of the female, and I am telling peripherally everywhere it is covered with the vata. And still she has to conceive, and so many things she has to do. Very important thing, Navanirmiti. Every month, formation of the Garbhashaya, wait, again elimination, Purana Raja is there, get it out, then Punha Nirmiti is there, Punha Artava Nirmiti, and so many things. This is what anatomical understanding for the fertility. Nothing new. Dikshit sir have cleared so many points, that's why I'll just skip. For the Artava formation, this is a what pictorial understanding for the Artava Strotas, Garbhashaya and Artava Idhaminya, which is totally covered or circumferred by the Sukshma Kesha Pratibadha. And where Shanay Shanay Upachay, from the Rasa, maximum classics have highlighted from the, it is Upadhatu of the Rasa, except one or two references, Raktam evam Srinam Garbhakoshtam Pravesham, or in Rakta Gulma, Rakta only entered. Otherwise, we can consider Rasa and Rakta comes through the Vyana Prerana, which is carried through the Rasa, Artava Poshakausha, yes ma'am, and transformed to the Artava. It happens in Ritu Kal. This all terms used by the Sushruta itself I am telling. And Shanay Shanay Upache, Vishwamitra Tika I have highlighted. Masat, it is not overnight, the calendar date have changed and there is Artava Nirmiti, no. In hormones we are doing, no. Hormones we are giving in 3 days, 5 days, everything is vanished. Shanay Shanay Upache, Masat. And when it is formed in Masat, then other criteria, Masat, Nishpichadaha, Rati and all. So this is physiological understanding. Right side, what modern is telling. Modern I have highlighted HPO axis is the long axis. I understand. Vyanavayu, that is responsible because who is coming Aharnish along with all the Poshakausha, part and parcel, he carried the Poshakausha to the Artava Strotas, where selectively Artava formation will take, is a long axis. That's why for Artava Nirmiti, along with the Rasa Rakta, along with the Strotasa Prakrutata, Vyana is important. And short axis according to the reproductive system from the models, like the utero-ovarian system. Same way, our short axis of the reproduction is under governance of the Apanavayu. That means the switch on and switch off. Common picture in polycystics. Periods are not coming. If it comes, it is not stopping only. So many doctors maybe they are getting this type of the patients. When one has to understand the apana vitiation. So the long axis and short axis we have to understand. Because Artavakshaya or so many Vyadhis, two types of the Samprapti, Avarodhatmak Samprapti or Kshayatmak Samprapti. When Dhatukshaya is there, Rasakshaya is there, Raktakshaya, post-malaria, post-dengue, post-typhoid, post-COVID, so many conditions when Avarodhatmak Samprapti or the local Samprapti, which is a short axis of the reproduction, is hampered. Just I will go through Jhalak. Preconceptional requisites is the requisites helpful for the assessment of the patient. I can't tell patient, you should have kapha prakruti so that you will get the very smoothly conception. No, these are requisites. Something I can't change, but at least I can modify it, or it will make feasible what is my aim of the fertility. I am explaining to the patient the soil, internal layer of the Garbhashaya must be soft enough so that the implantation is just example, so that the implantation is easy. Best quality seed I am bringing, too much good fertilizer, whether fertility will be, soiling will be here, no. I want to sow a plant, is it possible? Best marble from Rajasthan, Kota, no. Exactly opposite, Kichad is there, Chikhal, just throw the seeds. Good soil is there, good seeds are there. Same thing Sushruta want to highlight. When he highlighted Ritukshetra Ambubijam. Then what? Equal importance to all, and then the fertility will be achieved. Second thing I want to highlight, see, few references are there where infertility will be achieved. These are the guidelines or your HOD terms, it is the SOP. These are the components required for it. Opposite to that, you understand these are the causative factors or the strong hetu for the infertility or the loss of the pregnancy. So the prerequisites, these are the what classical references. One is the important of age. Just now we discussed previously, age factor also nowadays count. Age is not only the birthday or the calendar age. Something related to our dhatu or susthiti of the dhatu. If you are checking, this age, no one married reality. 1621, 1625. The considering me, that's why I told these are the prerequisites. We can't tell patient, अरे बाबा तुझं आता वय होऊन गेलं, आमच्याकडे 25 सांगितले. No one will come. They will tell mad, don't go to that doctor. In Goa, no, marriage age is so late. Up to 35 really, it's bad thing, just they are not marrying. And very next year they want conception. Or second thing quite common, after marriage, so-called understanding, I don't know, so many years they are sacrificing, 5 varsha, 7 varsha, then, genuinely problem is there, then you understand. Then very next year they want, and if they didn't conceive, they start depression. Then which problem we have to solve? Either depression, or we can't tell, no, go to that doctor, and they will not come. So this is the area wise the problem changes. So meaning of it, these are our prerequisites where the capacity of the body to take up the conception or the welcoming, friendly environment for the conceptus, welcoming environment of conceptus is already there. Your dosha, dhatu, mala are in, or your body is in swasthavastha. Physically, psychologically, spiritually, or so many angles are there. So that's why this is a very, very important thing. Nothing new in that, the age. Yeah, this is a controversial, still I know that. This is just Prakriti, I am not going to change, keep in mind. But at least I will check their Vikruti. Because this is a for example, already it is told. See, IQ concept is there. No, parents have 50% marks. Still they want their children should be a 96%. How? Is there? Then so many problems, children don't want to study or so many things. Till suicide. Are Baba Prakrutitaha, it is there. See, it is just for example, if you have a Kapha Prakriti, see, logical answers are there. Logical answers are there. I am just telling prerequisites already. Kapha Prakriti is there, where Sanganan, growth, Vruddhi, Vikas, Mardavata, Sahanata is already present in your body. Soil is always fertile. If you just throw the seeds, the results are there. Exactly ulta, Pitta or Vata Prakriti, Ushnata is more, Rukshata is more. That much achievement is not. That only the meaning of this slide. Please take a note of it. Sarata. I took the reference of the Shukra sir. I am not going to change Sarata for all patients. I am not going to make all the male for Shukrasa and female races are. No, but see that at least. That's why I think Dr. Dikshit sir have explained in detail the importance of the Shukra and importance of the Rasa. We call Rasiyata only going to turn to the all Dhatu Pushti and end up with the Shukra and the Oja. So, see, our aim should be, my target should be near to this. That's why I will modify my diet, or Vyasan are there, or Tambaku Gutka, or all that varieties, or alcohol, which is quite common in Goa, and they understand it is thunder. Any stress is there, beer is thunder. So many people they are telling. खूप tired झाले नी, थोडं मच्छी beer घेऊन आले, and it is quite applicable to female too. Female too. In our generation, barriers were there. Now it is equality. Male and female, though they are drunkards. Yes, there are so many names are there. Even I don't know, but they are loyally they are telling no, madam, occasionally. So the meaning of you have to cross that barrier and see that is my target. Yes, importance of what? Not only for the formation or savvahan or circulation, garbhakrutinam. Without it, it is not possible. Wherever the movement change or wherever it is required. Yes. We have good code of conduct for the copulation. See, underlying meaning, I am not that authorized person, underlying meaning, why fertility or infertility is increasing or fertility failures are increasing, they are not assigned. Their couple is not assigned. Maybe due to so many reasons. Previously, the code of conduct, what described in our classics, the couple used to have the mating, and there is a Sharira Shuddhi is there, Panchakarma is there, Amuk type of Ahar is there. Then See, then they are going for the copulation, then the fertility is sure. That means they have assigned. Now, see, that means the correct term is apatya priti was there. Now, rati priti is increased. Live-in relation, marriage breaks, fantasy and fallacy of love and physical contact. So, they are not assigned for loyalty. I am not using the word loyalty, and otherwise I am outdated. Yes. So, the fallacy, fantasy I am telling in what useful word for young generation. काय सांगते तुम्ही affair आणि leave it. So, they were not assigned. I am assigned here to tell a Vandhyatva kare Hetu. That is assigned. I am preparing so many days, reading, thinking, whatever it is. I am assigned. So, where in our Grantha, when the couple want to have a child, some gap is there after first delivery. That time they used to have 10, 12, so many. And everyone have good children too. So the meaning itself they were assigned, and for that the code of conduct is given. How, when and why they are supposed to there. Like for example, after cessation of the menstrual flow, where lady is isolated, having Sharira Shuddhi, they are supposed to go for the copulation. Then the positioning is also described. Then Purva Sharira Shuddhi is also described. Male and female, they are supposed to go for the possible Shodhan. Okay, that's why I am telling, just take a hint for it. If I am telling go Panchakarma department and do woman and then Virechana, it takes some months, they will not come. But possible way, okay, like in female complementary, at least give Virechana, Bastikram. What treatment we are generally following for all these Gammat Jammat chronic patients, so big file. First give the counseling definitely. Then based on her Prakruti, Sara, Vyavasai, or where exactly the fault is there, based on the Sharira Shuddhi, especially Virechana is helping. Then premenstrual phase. Definitely, Pitta Bhuishta, Vat is going to increase. That time, Snehan, Svedan, Bastikram. Then she get the menses. That time we are purposely advising the diet. I know the meaning of this shlok, still I am telling you. Then followed by the fertility agent. So, Grutakshir is supposed to give, or for the female Tailamasha, to increase the get potency of the Artava and the Shukra. Same way, see, these are the nadis described, and where the semen deposit, the pregnancy will be fruitful, it is given. Yes. Then the position during the copulation. We strongly believe positioning according to the sthiti of the Vata Pitta Kapha. If the lodgement of the Shukra takes place in that yoni, the results are promising. These are not in our hand, that's why I am telling extrinsic. There is again code of conduct, red alert for the female. She is not assigned. She don't want child. Advertising are giving. No, you use contraceptive, now मैं तैयार नहीं हूँ. Leave it. It is not by force. It is not by force. Still, same thing it is described in our class 6. Atishita, khake pike, shudita. Trishna, pipasita, bhita, vimana, shokarta. Okay, like that, definitely. There may be the failure, or they may anyhow she conceive. Viguna praja, abnormal conceptions may be there. Same way, ati bala, ati vruddhi. These are the references. Code of conduct, red alert for the women. That's why please assigned, prepare, do Sharira Shuddhi Ahar, and then go for the conception described in our classic, because there was no scope of the Rati Priti. Now it happened, he will go to another friend or lady, or something. What wrong thing may happen, but when this is a basic background years before, and that is true, that's why we are here, no? Generation to generation children are there, we are the part of it. Yes, this is a reference by the Kashyap. Shakatakruni yoni, like the cochlea, like zigzag, like the cart, This is not linear way. We are drawing picture, na, uterus, cervix, vagina, we are getting 5 out of 5 marks, linear way. But in body, it is not there. Zigzag positionings are there. So some yoni external pariksha, this is the darshana pariksha. A very rich knowledge or understanding was there. See there are different types. Ukshipta yoni is there. Ubri hui, bahir aleli, something tumorous, something growth. Suchimukhi, pinhole. Definitely there is a anapatyata or durbhagyata will be there. These are the references. These are the references what we have. Definitely manobhav. We used to know the Saumanasyam Garbhadharananam. We used to blame so many papers, so many researches, so many understanding, maybe chemicals, maybe hormones, maybe pheromones, maybe neurotransmitter. Yes, upper shlok is telling Sumanasata for the both. It is from the Vela Sahita, Stri and Purush. Husband is drunken, fighting, he has any shock for the wife, non-affinity, and they have copulation. Just imagine the scenario. Instead of that, Sumanasata, Prasannata, or meaning of it. There are so many meanings. Mana should be divided of the Bhaya, Krodha, Chinta, Shoka. When it is possible, they are assigned. They are assigned. If I am not prepared for exam, Are Baba, bahut fail. If I put the topic for syllabus, depression. But I am prepared everything. Divide up all these things. Second meaning of it is Rati Priti, affection and sexual intimacy for the resultant of the conceptus. I used to word as gluing. So many people we see. There is no gluing, there is a infertility. Harshotsukta, like Harshat, Tarsha, Shukra Pravartan is from the male side, but the lady should be eager enough for the conception. Decision making, hua to hua, otherwise my plan is embryo transfer is already there. Adaptation form diya hai, abhi main aapse thoda 1-2 mahine ke beech mein. Like that the patients are telling. Second option, third option. See, we are getting the number 1 options too. It takes years, not in overnight. Not in overnight. Still, so many things. See, decision is proper. Then the chintam, all the manasika bhava. If it is in normal condition, then see, then meaning of it, core meaning of it, higher centers are able to produce the so many hormones which daily basis I can't measure. I am doing FSH, LH, prolactin, second day, third day, I know the meaning of it, not in every day, not in every moment. At the moment when conception takes place, see what is supposed to happen, no, after coagulation, it happens in 15 minutes. We have to wait 14 days. If I am very keen, I can do the blood beta HCG. Very keen. That means some days I am supposed to wait. The meaning itself, what is supposed to happen, that time, see, Utsukata, Harshat, Tarshat, intimacy, contact or eagerness, it happens through the higher centers. That means Sharira, Mana, everything is involved in that. Then and there, then the sure for or chances for the conception are higher. See? These are the different meanings. We know that happy hormones, positive environment, positive thoughts, so many streams are there nowadays. These are the hormones. Yes, we accept. Same acceptance is given to for the Atma Pravesh. For that I don't have unit, madam. I don't have unit. Now I can, after 20 years, day will come, maybe. Then the success rate is high. So, happy hormones are there, serotonin is there, oxytocin, that is hugging or foreplay you can think, dopamine is there. Is stress, the word itself is telling sexual heat, ichha. Body is not prepared, mind is not prepared, from where conception there will not be a successful copulation. So, and other hormones, one has to understand, or I understood, this is under the question of the Sumanasata. That means the couple is having the Sumanasata, they have assigned, they are welcoming, their body is what Sharirik Manasik way normal, the chances for the fertilization is normal. Then we will see one by one, by piecemeal. This is a general understanding which is not in our hand. This is intrinsic. internal things. Yes, we have so many references about Aharatmak Hetu, Viharatmak Hetu, Yoni Vyadhi or Yoni Vyapad, Yoni Arsh. We have the big list of that. With reference to context, it is given. Then Aghat is given. Sahaja Vyadhi also described where it is going to work. It is a combo. See, mean for example, Mithya Ahar is there. It is going to work on Garbhashay. It is going to work on Artav. It is going to work on Bijashay. It may work on to the Manobhav also. That's why jumbling picture is there. So many Vyadhis or description is there. Simplest meaning, I understand. Couple is coming to you, they will tell their history, files are there, we also referring. Sometimes first we are taking the speciality of our treatment or our pathy is a detailed history taking. Detailed history, so many things which are not written, which are not understood, we can reveal it. Okay, that's why while understanding, we have to understand Dosha Dushti or Dushya Dushti, which factors, which component of the strotas is damaged or got vikruti. Like that, these are the so many references where the exactly directly classics have highlighted about the Vandhyatva and it is going to hamper. So, the core meaning, definitely they are doing the Kshetra Dushti in the terms of the Dosha Dushti or in the terms of the Dushya Dushti and so on. Yes, first it came. Yes, this is a one reference, Apraja Yoni. I hope this is the best reference. So many factors. Yoni Pradoshat or Yoni Dushti is there. Manasik Hetu is there, like Abhitap. Shukra Dushtikara Hetu are there. Ahara Vihara Hetu are there. Akala Yoga. Couple is separated, husband is staying abroad. This is also good scenario in our places. Once in a 2 years, once in a 3 years. For 15 days he is coming. This is a kala. Or which frequency the contact shall have, it is not happening. Or Rutukalin Sambandha is not there. Balaksha is there. Then Garbham Chirat Vindati. Where that Sapraja Vandhya or Avandhya Chakrapani I have highlighted here. These are the good example. This is the list. It's a good list which highlighted so many factors. Even the Sapraja, previously conception is there and now she is not able to conceive. I understand these references who are coming under the category unable to have a child. I am not stamping they are Vandhya, Sapraja or Avandhya, Apraja. Because what history they are telling, based on that we are treating. Sometime what happened, girls are so smart, they have MTPs and all and after marriage they are going to tell, I have 2 MTP. No. That's why we are supposed to understand these factors. See, Aghat. Simple as Aghat is trauma, means Aghat. Artava Strotas Vindhyatva due to so many reasons. There is a condition like the Maithuna Saishnuta will be there. There may be Artava Nash and Vandhyatva will be there. Along with that, upper reference. See, where Kashyap have highlighted Snehan, Svedan, Paschat, Mrudu constipation is there. And Ati Yoga of Panchakarma is happened. It happened. Virechana is given and Rakta through the Malapravartan Raktasrav will happen. As an effect of it, Bijopaghat and Artama, the shlok is incomplete. Bija Upaghat will happen, Timira will be there, along with that the Artavanash will be there. Okay, that's why Aghata to the Strotas, practical meaning we can understand, handling, investigations, invasive investigations, other like laparoscopy is there, hysteroscopy is there. I am not denying you don't do, you do, but while treating we are supposed to consider. Make that +3 to the 0 and then you treat. Okay, this is a one reference. When this type of the Aghata is there, it does directly Kshetra Dushti, it does directly Strotasa Dushti and Dushya, that is Dushya Dushti as well as related Dosha Dushti may be happened. Yes, this is a standard shloka. Mithyacharanam tamstrina. Mithyachara, madam, you have described in detail. That is the ahara and the vihara. Then the artava dushti, bija dushti, and so on the daiva dushti. Another one reference also in Bhela Sharirasthan. It is telling the same way directly. It is more highlighting Pathyakara or Yogya Ahar for that lady is not there who is willing to have a child. This is applicable to all the diseases also. I have Madhumeha or Prameha and this is my Pathya. If I am not indulging, I may get the XYZ diseases. The couple who are prepared, assigned or ready for the pregnancy, definitely for Vishuddha Strotas and all or Apradushta Garbhashay, they should have Pathyakara Ahar or Laghu Ahar or etc. That is core meaning of it, important. See, this slide I have just taken from the other because so many components I have to encompass in 1 hour. See, code of conduct about the diet and the item wise. Now Jamana is for 0 figure and Ulta polycystic or Medurajanya Vyadhi, Atita Santarpana Janya Vyadhi are also so much. So the code of conduct, if they have not followed, Adhyashan or Anashan, Viruddhashan, every code of conduct for the diet or the pattern wise, they have, I have tried possibly to clarify it. Already sir and madam have described, that's why I am not adding. Only the coloring agent and the food addictions. Turfarin chips are there or so many I am not listing, but definitely they are supposed to produce Vyadhi of the ovaries. They are equally able to do the endometrial destruction and failure for the ovulation. When we are understanding these foodstuffs in our terminology, definitely they do Vikruta Rasa Nirmiti or Samarasa Apachita Ghana, which is not useful. See, if I am taking Apatyakara Ahar, second day I am going to die? No. Or second day I will get that disease? No. 1 will go to the 100. My Prakriti is favorable. Best example, my Prakriti is Pitta Pradhan. I came from Kothurud in hot sun, and if you are giving me any spicy, then I may have this disease. But once in a while I have Batate Vada, is going to create no. When I am labeling the Hetu, it compasses 2 things, Satatya or the potency of that Hetu, Vispadli. Okay, it is a potent Hetu. So the meaning of it, they are able to do this type of the destructions. That is a method wise. Second, item wise. We use junk food, change in lifestyle, amuk thing chips. China had given 2 things, no? One is a corona and the second is a Chinese food. I asked one girl, even my daughter too, why do you like, why you are eating? She told me, sukoon milta hai. What type of sukoon, I don't know. Even I don't like that. Same thing, the fighting starts from home only. Why you are eating that kachara, junk? Dear friends, please understand these are the components. We understand this is Ati, Amla, Lavana, Ati, Kshara, Ajinomoto is the best example. It is a one type of the salt only. One type of the Lavana Rasa Pradhan only. They are doing so many distraction. So many things you have already taken. I used to give these terms. It's a Apadravya. This is Apadravya word is there for Yoni Vyapadhetu. Dravya and Apadravya. Not useful for your age. Not useful for your reproductive system. Not useful for your uterine lining and ovaries. They are going to distract. Because they are able to do the Pitta Dushti, Rakta Dushti. Or they are going to do the increase the Dravata and the Ushnata of the Rakta. They are going to distract the inner environment inside. This is AC. I am not sweating. I am feeling sleepy. As though you are talking. It's a good environment. Season is favorable, oxygen concentration, pH, everything is good. Same way. When everything, maybe the Shukra is normal, Shonita is normal, Srotas is normal, Vaya is normal, Prakriti is favorable. Why they are not conceiving? Because these are the destructive. This is just, please take a hint of it. Because on this topic also we can talk hours, 2 hours. This is just glimpse or the hint. They are enemies, reproductive toxins. I got no good new terms, even the surfing. That is Google favor. Reproductive toxins, uterine milk. Again, afterwards it will become endometrial receptibility. Yes, there is a reception. There is a reception for that conceptus, and the environment is not friendly. I have called someone to at my home and kutta chhod diya. Who will come? The non-reception. हुआ तो हुआ, आया तो आया, गया, अरे मैंने बुलाया था क्या? And exactly opposite. The same way, these are the enemies, these are the reproductive toxins, or especially Vandhyatva kare hetu, we are supposed to understand. Same way with the vihara. Some are the practical hetu I have added. We know that the mala, mutra and all vega dharan we are not supposed to do. Addition to that, artava veg. Of course, artava is veg or not, that is also controversial, fighting issues. But preponement and the postponement of the menses, so many people are, because they are going to change your internal system. Ati anayana and undue. Then the garbhapatakar and garbhastravakar pravrutti. They just don't want child now. Next year they want. Or after any, or few couples are coming, my child shall born before May so that he will get the academic year. Like that they are coming, and now I don't want. Then I told, after 3 months, is this guaranteed? Are you going to conceive? So undue, there is a trauma to the strotas. Because there is a lekhan or any medicines, they are going to destroy the rasa. Then directly aharatmak hetu, maithunajanya vikruti or apriti or ati maithuna, fantasy, fallacy, multiple partners and so many things. Sexual pressure, toys or medications or Viagra like injections, so many things. They are going to destroy. These are the practical hetu. Or very important thing, paricharya during Rajastrav, after Sutikavastha or even after the post-abortion. Because the physiological changes are there. During Sagarbhavasa, 9-month changes. During, that is after abortion, so weeks, 8 weeks, 10 weeks, all physiology have started. Morning they are doing MTP, evening they join office. Internal damages are there. How we are going to repair? In our classics, there is a one word, punarnavi. Repairing in Sutikavastha. If you are giving the Sutika Paricharya to that lady, she will Sharira Shunyatvat, her body is become zero. Now there is a rejuvenation. The word is a Punarnavi, or a minor degree. Explain the patient, abortion is a mini delivery itself, or internal changes are there. If the Paricharya is not proper way palan, like Prasava Paricharya, Sutika Paricharya or Rajasvala Paricharya not palan, it is going to be happen a hetu for the improper vihara. Then yes, excessive use, essential use or misuse. I don't know what terms I am supposed to use. Or gadgets, mobile, your what notes or earphones, or best word is the screening. Now previously it was there, don't keep your mobile in pocket, it is going to get your azoospermia. Still, many versions are there. Excessive exposure, yes. These are the radiations. Ovens, computers or that media itself, they are going to destroy definitely, and it is proved. What words it is written, no? See, I have read and compiled, not like Mary Murji. Okay, that's why they are going to help in so many ways for the destruction. Shukra Vikruti, Shukra Nash, Artava Vikruti, Artava Nash, it's there due to that. Yes. This is one example. See, in Yoni Vyapad Hetu, no, Artava Dushti is one of the component. And from Artava Dushti takes place, we have to find out. That's why I am telling reference to context. Everywhere given in everywhere. See, Ati Ushna Pan is there, or Ati Ushna Anna Pan is there. It is one indication. Then Nasya to the Rajasvala, then Rajastrav is going on. These are the contraindication, and still you are giving. Then Tikshna Shodhan and Rutucharya is not followed. Then there may be the Artavanash. What we discussed already. Yes, this is just elaboration or just ready recognition for you. 8 types of the Artava dosh. Causative factors are not directly given because it is given in Shukra Shonita Sharirasthan 2. And different types of, and see, this is a possible correlation. The core meaning, if dosha dushti takes place and able to do the artava dushti like shukra dushti, these are the possible lakshan which and the end result of it, upadrava of it, the pregnancy will not be achieved. Say, first of all, see, Yoni Vyapati describe in detail. The meaning of the Yoni Vyapat, in good reproductive age, these are the diseases, different variety, different presentation. See, even though the numerology is 20, if you compile Charak, Sushruta, Vagbat, it is more than 25 major diseases. Already some Yoni Vyapat, they have directly indicative there is a Vandhyatva. And all Yoni Vyapat, maybe there is a Artava Dushti, maybe there is a Sahaja, that is Hetu taken by the mother and the father. There may be the Artava Dosh, there may be Bija Dushti, there may be so many things. End result of it, Upadrava of Yoni Vyapat is again Vandhyatva. Gulmarsha Pradaransha Jayate, Vandhyatva is there. Nach Shukram Grunnati, not able to conceive, not able to fertilize, not able to able to produce the Garbhavapan. There are some references. Just consider this is an example, maybe one or two may be missed. Like the Prastrausini Yoni, which is a Pitta Pradhana Yoni is there. Falini, that's why Pitta and Vata Pradhana Prastrausini. Falini Yoni is there. The Yoni Mukha is Suchi Kara or allow the only Sui. Shushkata of the Yoni, Shushka Yoni is a Vata Pradhana Yoni. Tikakar have highlighted if the Yoni is Shushkata, there is an Artavanash or Anartav followed by the Vandhyatva. Karnini Yoni is there. Fault or Hetu 7 during the delivery. Akala is there and Pravahana is done. And it is affecting to the Karnikakar Granthi at the level of the Garbhasya Mukha or Yoni Mukha, which will do the Artavanash and Vandhyatva. Antarmukhi Yoni is there. Improper ahar and improper maithuna karma. Due to that, Yoni Mukha Vakrata takes place and along with all lakshan, the lady will become Vandhyatva. These are the references. There are some references of the directly Vandhyanashtartava. Due to some another reason, Artavanash is there, she is going to have a Vandhyatva. Vamini Yoni, Shadahat Saptaratvatva. In 6 days or 7 days after copulation, with projection like the woman, projectile, uncontrolled way uterus squeeze off and what is inside, Garbha is there, it is going to eliminate. Or Jatagni and Putragni, this is a practical problems we are facing. Stitam Sitam Hanti, Jatam Jatam Hanti. Garbhotpatti, first phase is over. Shukra, Shoni, Tamuk, everything is normal. There is a problem of the implantation. The presentation what we get is a recurrent abortions or new terminology. Why it happened, why it happened, why it happened. It's the Appala syndrome. Body is not accepting. I know it is immunological complex. I know the body, mother only producing antibody against the child. That means uterus is not giving environment for the continuation of the pregnancy. There is no issue of fertility. Patient can easily conceive. There is no problem of the fertilization. Problem with the implantation. Problem with the Garbhavapan. Problem may be related to the Garbhashaya. Maybe Garbhashayastha Poshakansha that is coming from the Rasa Rakta. That's why the importance of the Rasa Dushti sir or Rasa is highlighted by sir. Definitely yes. Problem is lying there only. You are giving water to the plant. Which water? Bathroom water, which is containing soaps and all. There you are doing plantation. You are expecting so big crops shall come. Or you are giving the water from the fertilizer. So many things. That's why Dushita Artava, Dushita Garbhashaya or Dushita Sthana is Dushita. So the Jatagni or Vamini like the Yoni Vyapat like the Lakshana are present in clinical practice. Directly it is given Stitam Sitam. As soon as the implantation occur, it kills that uterus, kill the baby. Or Jatam Jatam. Two meanings of it. Jatam Jatam means Zhalavar. Means either implantation or baby born and baby dies. Because Vikruta Artava and Artava Dosha. Okay, these are the some references. These are the possible photographs which was highlighting. So, when you are screening Yoni Vyapat, these are the, see, where Mataj, Pittaj, Kaphaj or Doshika yoni vyapad are there, or the condition like the shushkata, lohitakshaya, putragni, the core targeted vikruti may be at artha due to tattas dosha, vata prakopak hetu, vataja arthavadushti, vataja type of lakshan, and that's why this is, we have to understand in this way. Directly kshetra dushti, rachanatmak vikruti is there, like mahati yoni is there, prastrusini is there, shushkata is there, suchimukhi is there, like this. Avarodhatmak, where the involvement of the kapha or along with kapha and vata, kaphaja yoni is there, upapluta yoni is there, paripluta yoni is there, along with pitta and kapha dushti, the major samprapti is avarodha. Still, we have to understand reversal way. Doshika dushti, due to what? Ahar or vihar or janmaya. Then the charanajanya yoni vyapat, where the vandhyatva may be there. That's the maithunajanya hetuts. Ati charana is there, acharana is there, and a prag charana is there. Strong enough to explain, the girl is not mature enough, and maithuna karma happened. Ati charanam, bijam na vindati. They have highlighted. Due to ati maithuna karma, there is a show for at the yoni, and afterwards, due to that, there is a no implantation. Acharana having the two many meanings, charakukta acharana, where there is a problem lying related to the maithuna karma or incompatible couple, and vagbhatokta acharana, that is krumijanya. Visheshata only major vata vikruti like the udavarta, vandhya, maha, suchimukhi, because all yoni vyapad they may end into the gulma, arsha, tattad dosha prabalyatat. Bija dosha is there, then the shandi, poor thing, hetu seven by the parents, sufferer is a female child. Okay, these are the ready references. Na shukram dharayati, na garbham grunhati. I understand two conditions. Failure for the fertilization, failure for the implantation. Yes. This is the one controversial. This reference I took from the Upadosha. Dausha Upadosha. I have the clear meaning of Upadosha. See why I selected this shloka. All faults, see, related to the Maithuna Karma and how it takes place, how Vyadhi, action to reaction, Dausha and Upadosha. So understand this concept in this way. Action to the reaction. Gifting from male to the female or gifting from female to the male, that is a sexually transmitted infection. That's why on that slide it is there. Now practically it is applicable. Each word to word. See, Ati Maithuna, then Ati Brahmacharya, then Ati Brahmacharya Chira Utkrishta. That is stress, is sexual heat is not there in that lady. Then other, what structural abnormality is there? Karkasharoma, Dirgharoma. Then Mahadvaram, Apriyam, Akamam. Same thing. If the lady is having or Dushta Yoni, Kuyoni, Viyoni, Yoni Roga Srushta Yoni, or she had already disease, and if she have, because Tika is highlighting it is not, we are not supposed to understand only from the male, Dausha and Upadosha. In this way you understand. That's why purposely I wrote, or where exactly, so many references we are considering. Where exactly? Easy to tell, Artha Udosh, Amok, we have investigative gadgets also. But what exactly happened? In that reference I was reading the sexually transmitted infections. The good thing, good word I understood, all organisms, tat organisms, they entered into the cavity and they make a film. Then yes, this is easy. This is easy. Something dosha dushti happens. Dushita ras is coming to the artha vastrutas. Say example, garbhashay, or which is going to produce the garbhashaya. It is going to produce. If the dushta rasa is coming, like example, kapha bhuishta. Rasa is there, it is not zero. Dushta rasa is going to. Maybe it is too much stan or kapha bhuishta, it will obstruct, avarodha and not come, or less quantity. Then we may get that type of the vyadhi. Not that much dushta kaphajanya. Pitta dushta rasa will come to the garbhashay, which is going to produce your garbhashaya, which is having ushnata, which is having tikshnata. It will work like the filming. Why I am correlating the word? That's why I am clear cut mentioning. I have the idea of the dosha, upadosha, sexually transmitted infection. This is not applicable. Just understanding the samprapti of it. Because if I'll start now all Vaidya and samprapti, it take 4 hours. Okay, this is just hint. They are capable, they are able to produce this type of the Vyadhi or Lakshan which end up with the Vandhyatva. Shadbhav are there. If I cross the limit, please tell me, because adat se majboor. Then the Matrujadi Avyo, they are equally important. Yes. These are well-known words, easy for understanding for Alpamati Vaidya like us. Sushruta had given the example. These are the spare part. Essentially, it must be there. One another is abnormal, your goal will not achieve. Okay, this is the positive verse. No? These are the components, Sayog of it, then Ankuratpatti will be there. I understand in relation to the Vandhyatva, if one another component is Vyadhijanya, result is Vandhyatva. So, just in short, Rutu, you know that so many meanings are there. The reference is from the Sushrut, who is highlighting Amuk days, Amuk Ratri from the day first. In curriculum, we are understanding Rajakal, Rutukal, and Rajovyatitakal. Not like that. Sushrutukta, Rutukal start from the day first, where so many things happened. So many things happened. Purana Raja Pravartan takes place. See, just imagine planning. Just close your eyes and understanding. What happened? Nothing new in that. It's just interpretation. Purana Raja, which is saturated for so many days, action of the dosha dushya takes place, which is welcoming that garbha. It is of no use. Purana Raja is eliminating. So, when it is going on, Yoni Shuddhi takes place. Yoni Shuddhi is having so many meanings, so many things. Yoni Shuddhi is there. Uterus or the system is moved to create a new artha. Gradually, not in override. Books it is given 12 days, 16 days, 19 days, there is difference of opinions. So many days, Nutana Arthotpatti start. Nothing but repair of the Kshetra. That's why no, Rutu Kshetra all, everything happened in Kshetra. Rutu is a season, favorable season. Like rainy season is there. From the day first to the 4 months, same rain will be there? No. There is an environment changes, there are chemical changes, even from the soil to the plantation, everywhere. Then the gaseous exchanges are there. Same thing happen in uterus. So the meaning itself, repairing of the srotas will be there. Srotas start getting nourishment through the Ambuvahan. So in Rutukal, there is the Kshetra Nirmiti. In Rutukal, there is a proper Ambuvahan and it end up with the Bijotsarga. Students are telling what is Rutukal? Ovulation. So, no. Rutukal have the so many meanings. So many events takes place. So, where the influence of Kapha dosha is there. Okay, that's why lubrication, moistening, wetness, snigdhata, ghanata, it present all parts of the srotas, maybe garbhashay, maybe bijashay, maybe ardhavayini. See, these are the major milestone event takes place. Naturally, all parts of the srotas, they are ready for the reception of the sperm entry. Okay, that's why in Shushka Yoni, Vataja Yoni, Amuk Yoni, these events are not there. Or Pitta Bhuishtata is there. Shukra Shonid, everything may be normal, but this reception facility is not there. See, one reference is there. We know that preconceptionally male has to feed Grutakshira. There is a one reference, Grutakshiradi Nitya Nishevanam or Grutakshiradi Nityasi Uditasi Kaphatmasu. If the lady is having Kapha domination or Prakrutitaha Kapha dominating lady, Prakrutita Kapha Prakruti lady, her diet is Kapha Bhuishta, Kapha Pradhan Ahar. She is happy enough, Uditasu. Happy enough, all happy hormones or pheromones are working and she is taking Grutakshiradi Nitya all dairy products. Madam have well explained the importance of Ghruta and Kshira or Purnahar. I will. Where the Artavam Tishtati Chiram. Artav remain prolonged. Word to word meaning? Because there is Garbhashayasta Artav, there is a Bijashayasta Artav. Longevity for the ovum's life will be increased. That's why protocol I am telling. Previous ahar correction, then Panchakarma or Shodhan followed by the Bastiyadi Karma. Have the one menses, then you start so that this Rutukal will be prolonged. Rutukal, chances for the fertilization. Rutukal will be prolonged. That I want to highlight here. And there are so many meanings. That's why in Rutukal, Varna Vyavastha, I'm just sorry to say this is not applicable. We are also not accepting. But imagine years before. Brahman, Kshatriya, Vaishya, Shudra. According to that group of the caste, Rutukal differs. What is the difference between that? Dosha Dhatu also called same, no? Only the difference was the ahar, that time, and working pattern, Vyavasai. That's why the Brahmani lady who had a Grutakshira Nitya Nishevan, where the Kapha Bhuishtata is there, the chances of the fertility was high. That is the meaning of it. That's why I have included. I am just inducting or injecting new concept, nothing new. It is not from my brain. Just I try to underline it. See, this is a picture. See, this is a menstruation blood. Practically, those patients who have the problem, we are supposed to check it. Grantha it is given na nishpichadaharati, no vatapitta dushti, natyati natu bahulam, no viranjan of the clause. What it means? The menstruation is a mirror. What happened last 28 days? This is the only what diagnostic criteria. We are asking the after how many days you are having the menses, or how it is, whether there is a pain or niyamita. This is a clinical entity. Based on that, we are understanding. One lady have the aniyamita rajastrav. That means the roughly I am telling, just don't take word to word. Vata vikruti is there. Maybe Vyadhijanya, maybe Aharatmak, maybe Prakrutita, or so many things. So this picture is highlighting different colors of the menses. We understand Matravat, normal. Pancharatri Anubandham, Nishpichadaha Arati, Asholam. No Arati, no Pichilata. According to Dosha Dushti shall not be there. Or Kapha Bhuishta Dushti is there. She will have the Pichila Artava. Like that, one has to understand. That's why I kept this photograph. Yes. So, Rutu means season. Any abnormality in Rutu dosha, like aniyamita rajastrav, sashula rajastrav, ati matra or alpa matra, alpadin or atidin, abnormal swarup. In rakta pradar or artava doshna, different colors are given. Or upama is there, mausakhandavat, gairika jalavat, kinshukodavat, different colors. Or majjavat. This is, see, Vyaktibush. Patients' menstrual flow having the abnormality, it indicates reversal pathology. We are supposed to think that's why all variety of this comes under the Rutu dosh. That's why irregular menses, poly, lokar yetat. Yes. I will finish in 5 minutes, sir. Yes. So it is leading to, because I tried to what it affects, that's I wrote. Then Kshetra is Astrotas, nothing new in that. Kshetra we have to understand same way, conception failure or implantation failure. These are the space occupying lesions. How we are supposed to understand these modern diseases in our classical references. Yes. Only one concept I will highlight. This is a very recent. I am working on that. Endometrial receptibility. Everything they are trying. IVF. ready baby is there, ready embryo is there, still uterus is not accepting. Capacity for the implantation is failed. Why? Because the proper endometrium is not formed, proper blood supply. Same way, ambu is not proper, dhatu, that is artau nirmiti is not proper, where garbhashayan is not possible. This is a very recent concept going on. The modern science is working, and see, I am not interested in their window, but the patients are coming with this file and they are telling, इसमें आप कुछ कर सकते हैं तो देखो. I am doing what I want, but still अरे उनको भी बोलना पड़ता है. So these are the essential factors: thickness, pattern, or blood flow. So meaning it must be hostile enough for the embryo, welcoming. Window of implantation, that is our Rituka. Then the tubal factors. Each factors, because I had given the so big Hetu and I am supposed to complete 87%, 87.5. Cervix, same thing, hostile cervix, vaginal hostility, where the death of the sperm occur there only. Okay, that's why motility of the sperm is very important instead of count. In IVF and all, ready-made pregnancies, ready-made garbhotpatti is there. They are only targeting weapon. Ambu having the so many meanings. That's why keep in mind, weightness is required. Ambu vikruti may be kshayatmak, vahanatmak or viddhakarma. Bijadosh known to us. Bijashaya and Bijadosh I compiled. So, Ritukshetra, Ambu, Bija, etc. are essential component. Dushtikar, Hetu and Chikissa shall be considered on Sharira Bhava, and that is obvious in reproduction. Our aim should be to make a sperm friendly site, able to transport the sperm and help for the fertilization. So, first of all, I am very much highly thankful in Punyanagari Gogate Pratishthan. They called me and given me opportunity to share my views. Any mistake is there, please consider my mistake, not our science. See, we are gathered here, just 1 minute. We have gathered here to promote our science. Okay, that's why study and patience is the key. Second thing, all well-learned Vaidya. Thanks a lot for patience hearing. Suggestions are welcome. Once again, highly thankful to you. Thanks a lot.